Hi, I am here to tell you about respiratory syncytial virus, or RSV. RSV is one of the most common causes of childhood breathing problems and lung illnesses like bronchiolitis and pneumonia. What is respiratory syncytial virus, RSV, infection? RSV is a common cause of childhood illness and pneumonia in babies. RSV infection can cause sneezing, coughing, wheezing, runny nose, fever, and decreased appetite. It can also cause dangerous illnesses such as bronchiolitis, which is inflammation in the lungs, or pneumonia, which is an infection of the lungs. Any person can get infected with RSV, but children less than 2 years old who are infected with RSV can get very sick because their airways are very small and their bodies aren't strong enough yet to fight infections. How is RSV spread? RSV can spread through contact with other people around you who are infected with the virus. If a person with RSV coughs or sneezes near you, droplets with RSV can enter your body through your eyes, nose, or mouth. You can also become infected by kissing someone with RSV or by touching objects that have RSV on them, like a toy or blanket, and then touching your face without washing your hands first. You will usually get sick within 4 to 6 days after you have contact with RSV. You can then spread the disease to other people for 3 to 8 days. Health risks with RSV. Healthy babies who become infected with RSV can get a mild illness like a cold. Some babies, especially those who are born early or who have health problems, can get a more serious illness like pneumonia. They usually get better after 1 or 2 weeks, but babies younger than 6 months old may need to be treated in the hospital. How do vaccines work? Vaccines work with your body to protect against diseases. They help to make antibodies, or protective proteins in your blood. Vaccinating a pregnant mother can protect her unborn baby from diseases. Her antibodies can be passed to her unborn child in the womb to protect the baby after birth. You can help doctors find a way to protect newborn babies from RSV by taking part in a type of research study called a clinical trial. Testing of new vaccines. Before a new vaccine is used regularly, doctors and scientists must test it in a research study called a vaccine clinical trial. Doctors at Pfizer are working with doctors around the world to test a new RSV vaccine in a series of vaccine clinical trials. What is a vaccine clinical trial? Vaccine clinical trials are one of the last steps in developing new vaccines to treat or prevent diseases. People volunteer to take part in a vaccine clinical trial. Clinical trials help doctors and scientists make sure the new vaccine works and is safe. Vaccines during pregnancy. Vaccines are an important part of healthcare and help prevent and control diseases. When enough people are vaccinated, it helps protect the whole community. Preventing RSV in newborns and young babies is important in every country. When a pregnant woman gets vaccinated, she isn't just protecting herself, she is also protecting her baby. What is the reason for the Matisse vaccine clinical trial? The Matisse study is testing to see if an injection of RSV vaccine in healthy pregnant women will prevent their babies from getting RSV disease after birth or make the illness milder. This study will also check that the vaccine is safe for the mother and her baby. How will I know if I am getting the investigational vaccine or a placebo? There are 2 groups in this clinical trial. One will get an injection with the study vaccine, the other will get a placebo. The placebo is a liquid which doesn't have any active medicine in it. The groups are chosen randomly, like flipping a coin. Your doctors and you will not know which group you will be in until after the vaccine clinical trial is over. Using a placebo will help us find out if the new vaccine works or not. Who can join this vaccine clinical trial? Approximately 7,000 pregnant women and their babies will take part in this vaccine clinical trial. You may be able to join if you're between the ages of 18 and 49, are in the later part of your pregnancy, are healthy and expecting a single baby, and if you agree to the study's schedule of visits. How long is this vaccine clinical trial? You will be in the study for up to 10 months. Your baby will be in the study for up to 24 months. If you choose to join the study, you will go through a screening process to see if you can join. Is joining the vaccine clinical trial my choice? Can I leave before it is over? Joining this study is voluntary. It is your choice if you want to join. If you decide not to join, your regular medical care will continue with no change. If you join the study, you can leave at any time if you want to. You will not lose any benefits or medical care. What about side effects? What if we get sick? The study doctor will answer all your questions about this vaccine clinical trial and explain procedures like blood tests and possible side effects. You will be told everything you need to know before you agree to join. Always let the study doctor know about any changes in your or your baby's health immediately. Informed consent. You will be given a chance to ask the study doctor about the vaccine clinical trial. You do not have to join the study if you don't want to. You do not have to decide immediately if you want to join. We want you to think about it and talk to your family and your doctor before you decide. If you choose to participate in this clinical trial, you'll be asked to sign a paper explaining everything we talked about, called an informed consent document. This means that you agree to possible risks and benefits of the study and agree to join it. You'll get a copy to keep. Thank you for thinking about joining the study.